at Sydney Airport, just leaving for my 29th RSNA. It's around 36 degrees. It's going to be around 0 in Chicago when I arrive, so a little different to here.
Welcome everybody to RSNA 2024, the world's largest radiology conference right here in Chicago, Illinois. 50,000 delegates all around me from 140 countries. We have education courses galore, I think around 300 education courses, 800 scientific papers being delivered this week. All put on by the college, of course, and 650 exhibitors, of which we are proudly one of them. It's an amazing conference, an amazing few days. I'm here in front of the MRI glitter wall, which is, I think, a sign of the glittering technologies that are available from Canon Medical, which the team will share with you over the course of this video. So welcome everybody, looking forward to seeing our ANZ customers and sharing the exciting developments from RSNA with you in person, but in the meantime, please enjoy this presentation.
I'm excited to share some of the results of our Made for Life development activities, which includes the most advanced AI technology, the peak imaging, which are very important for our current CT and MRI products.
It's been a great RSNA for Canon this year. We have so many new technologies coming. Certainly near and dear to my heart is our photon counting announcement that we made with UPenn. We're starting to see some great images out of there, and that adds to the image quality that we're seeing from Nijmegen and from the Japanese sites. We also, of course, have the Insight scanner. A lot of the technology in that Insight scanner, such as Peak, came out of our lab. It's so gratifying for us to see that technology go out and start to change patients' lives.
The other thing that's new for us this year at RSNA and is really exciting are the workshops that we're conducting. We've had up to 120 people in the room trying to fit them in because of the calibre of the education that's taking place. This is education that's being performed by our key partners from around the world who utilise our technologies in clinical settings and are making a real difference to patients' lives. Kind of make life a bit easy for us because they're doing our job for us and really spreading the word about the difference that Canon makes.
So this year it's been a very busy RSNA in CT. We're showcasing our new range of CT scanners, starting with the Aquilion Serve, the Serve SP and the Aquilion One Insight Edition. And we actually won the best new imaging device in radiology for the Aquilion Insight Edition, which is very exciting for us as well. Our customers have been really excited about some of the workflow benefits that come along with these systems in terms of our Instincts platform. Very excited about the large wide open bore, the inbuilt gantry cameras for positioning and the unique lateral couch movement as well. Canon's roadmap of product is to bring to market across the whole range high resolution imaging through deep learning reconstructions such as Peak 1024, low dose imaging through technologies such as our deep learning reconstruction AICE, and workflow innovation through our new Instincts user experience platform. Everyone that's come and seen that on the booth has been very impressed with the image quality, particularly for cardiac imaging and lung imaging. The quality of our lung imaging using Peak 1024 and how exciting that is to be able to get that really high resolution imaging without the need to go necessarily to a photon counting CT. And everyone universally says how easy it is and how fast it will be for their workflow. So that's been great feedback to get.
With interventional radiology on the verge of achieving specialty recognition in Australia and New Zealand and the increase in AI-assisted decision support, it's no surprise there has been an increased interest in interventional radiology as a specialty area. The Canon Angio-CT is the perfect solution for all these things, as well as effective diagnosis and treatment of trauma patients in the one room. I think Canon are perfectly positioned for the interventional revolution with its diverse range of IR and hybrid solutions across cardiovascular, oncology and trauma applications. This year at RSNA we gave customers the opportunity to step inside an angio-CT laboratory by means of virtual reality program. The real story though is the development of a deep learning AI algorithm for real-time fluoroscopy called Evolve Imaging. And Canon have released the first version of Evolve for coronary arteries.
My experience here has been fantastic, talking to people from all around the world and finding out about their requirements for PET-CT. I'm most excited with sharing with people the technology of our PET-CT, and people here have been commenting about how large our bore is on this system to be able to cope with those bariatric patients, the non-compliant, but also people that are just worried about being scanned. We have got improved time of flight on this system at 238 picoseconds with an effective sensitivity of 130 counts per second per kilobecquerel, which means that we have more accurate scanning, faster scanning for our patients. The main trend for PET-CT is obviously about better image quality. If we can use technology like our deep learning reconstruction ACE, we're improving our image quality, which improves our patient lives.
Here, after speaking to all our customers and colleagues, has been the improvement of workflow through automation. Our AI-powered Altivity platform allows us to deliver just that to our customers.
What I'm seeing, the main trends at RSNA have continued over the last few years around artificial intelligence. This area is absolutely exploding, not just outside medical imaging, but inside medical imaging as well. And this covers all aspects, from workflow to image quality, analysis and reporting. And I'm pleased to say that Canon has multiple tools in AI, helps with measurements, helps with workflow, and we have those available already on our platform. Canon's roadmap with AI technology aligns perfectly with what we're seeing in the industry. It's all about workflow, it's about efficiency, and it's about having more throughput with the patients, and it's about more accuracy as well. So Canon is definitely at the forefront of the AI revolution. I've had some amazing feedback from customers at this RSNA, particularly around depth and detail, our high resolution imaging, our high frequency imaging of nerves in particular, which is also a growth area that we've noticed, not just here at RSNA, but around the world. The standout feedback that I get is from our customers who come and watch the live scanning. So when I'm scanning, I'm using high frequency transducers and I'm showing nerves and structures that they have not seen before on ultrasound. Our resolution can show the smallest nerves in the human body, which just pushes the boundaries further of what we can do in medical ultrasound. What I'm really looking forward to sharing with people when I get back is my experience at RSNA around liver analysis, our shear wave technology, our attenuation technology. The latest iLead paper that has been developed over the last few years has been shown at RSNA. And this proves our technology, it validates our technology at being robust and accurate.
I always love RSNA. What I like most about it, and this year is no exception, there are people with ingenious ideas and it's fantastic to see that. I always get a look into the future of what's coming, so when we invest in our business going forward, we can have a futuristic plan, not just buy another widget for tomorrow. So this year I was most impressed by the photon counting CT. I like their approach. I like the fact that Canon's quite conservative and they don't release product that really works. Of all the things on the stand, that's most impressed me. So anything that makes examinations quicker, anything that makes examinations of higher quality, anything that increases the efficiency of the radiologist, always a direct patient benefit.
I think the advancements in CT has probably been the best one. We've had a recent tender for the organisation, and Canon was successful in our CT angio space. The integration of their CT with the angio suites is part of that process. So I think that's probably one of their major advancements. I had a good close look at the CT and the advances they've got in their technology with manipulation of images, but also the use of, again, AI. It's a very big component of the organisation as part of that. So that was probably the best thing I saw from a Canon's perspective. There's been significant movement in the software technologies. There's more assistance for the radiologist to be able to recognise what's wrong with the patients, to improve diagnosis. The speed of diagnosis is part of that process. So I think the turnaround time for identifying diagnoses and treatments for patients will improve significantly. And that's changed dramatically over the last 3 or 4 years, and has been demonstrated here, certainly at the RSNA that I've seen this week. It's been great.
Clearly, the ongoing focus on AI is really big here. But what I'm seeing this year, as opposed to necessarily image interpretation, is AI use in image acquisition and reproducibility and making medical imaging technologists' lives more easier. I've been really impressed by the Canon Cartesian Prime SP PET-CT. It's a very wide bore system, looks really simple and easy to use, and I think our techs would really appreciate it and produce great results for our patients. I think the ongoing development of the Canon CT profile is really good. They're really robust, strong systems and easy to use, and I think that technology is a really good ongoing aspect of the Canon portfolio.
Customer feedback is everything. We established the company, the Canon Healthcare US, to work with those who can provide such insights to us, for us to be able to put those requests into our development and come up with the solutions.
We work directly with the customers, with radiologists, with key opinion leaders, to drive the way that we shape our technology for the future.